have been staying away from my family since I was in 11th standard because I did not tell anybody for like 1 hour after finding the result out because I was genuinely just in shock.
What are the pros and cons of taking radiology?
Whatever you see, the entire world out there is not seeing, especially in India.
Being a radiologist is that in some sense you're a doctor's doctor.
What that means is that if you're taking radiology because it is a chill branch, then you are mistaken.
Tell me a little bit about your strategy of cracking the exam. Any particular techniques, any particular routines? All India rank 1, NEET UG 2017, committed suicide.
That was my senior from UG also. If you are somebody who feels like you lack structure, then writing a diary is a good habit.
Hi, this is Abhijit. I'm the co-founder of Knya. Knya is a brand to celebrate medical professionals with the most comfortable scrubs and aprons. We've launched a new podcast, Behind the Scrubs. Behind the Scrubs will be honest conversations with medical professionals about their journey. So if you're a medical professional, tune in, hear the tips, hear the advice, or just hear the journey of a medical professional. I'm sure these conversations will be vulnerable, they will be exciting, they may even be funny. But more often than not, you will learn a lot. So tune in. Dr. Jui is a UG and PG from Seth GS Medical College and KEM Hospital. She secured an All India rank of 7 in NEET PG. Today we are very, very excited to have her here, and I'm sure thousands of medical professionals can learn from her journey and already are so inspired by what she's achieved and will continue to achieve in the many years to come. Thank you so much for being here, Dr. Jui.
Thank you for having me.
Very excited to have you here.
Yeah.
So why medicine? Obviously, I know you come from a family of doctors. You just told me your dad's a doctor, your brother's a doctor, your sister-in-law's a doctor. So I guess there was a lot of pressure and maybe you taking medicine as well. Walk me through your journey.
Yeah, so not so much of pressure, rather it was an inspiration. So because I've always, ever since childhood, I remember watching my father talk about medicine. Like our dinner table conversation would be a surgery, or we would watch surgery videos, which he would use to learn from his mistakes. He would film his surgeries and then he would play them on the TV. We'll be just having lunch and watching a surgery like it's no big deal.
Yeah.
So it was a really inspirational factor from my father, and the love for science in school, and then love for biology in 11th and 12th, and the love for medicine. So more than pressure or anything, it was just the only path I knew and the only path which I genuinely liked. So that's why medicine.
Super. So doctor, I have to start with it, right? I think you got an All India rank of 7 in NEET PG. A very big deal, right? One of the most competitive, arguably the most competitive exam in the country, right? So tell us, what were your emotions? How did you feel after you saw the rank?
Actually, now I think most people watching will feel like this is a little irrelevant now because it's already been more than 1 year. Like there's already another AIR 7 NEET PG 2024. So I am no longer that relevant as much as I was 1 year ago. But yeah, so it was one of the happiest moments of my life. It is genuinely one of the toughest exams. Like after giving NEET UG, you come to NEET PG and then you realize that this is the real deal.
Yep.
Like NEET UG has nothing over NEET PG simply because of the fact that the amount of seats are so less, the amount of people applying for it are like 10 folds or 50 times more than the amount of seats available. So the competition is really high, and I was absolutely not expecting. I was just hoping for like a 3-digit rank or like a 1000 something, like under 2000, like under 2K rank. And when I saw that result, actually I saw my marks first, which was 715. And I was like, yeah, decent rank hai. 715 is a good rank. I'll get medicine in this rank. And then my friends are like, dude, that's not your rank. Those are the marks. And then we saw the column next to it, and then it was my rank, which was 7. So it was unbelievable. I did not tell anybody for like 1 hour after finding the result out because I was genuinely just in shock, and I was in disbelief that this possibly can't be my rank. And so I asked all my family members to confirm it. I sent them the list. I sent them my roll number. I was like, you check it. Everybody check it. Let me know. Only then I will tell others that this is my rank. It was a great day. Like my parents and I just reminisce. That day was definitely one of the best days of my life.
Super. I can feel the emotion while talking to you, right? So super. As an intern at GS Medical, were you always inclined towards radiology, or was it something like, you know, they call the topper suite dilemma, right? That you get a top 10 rank, and now you're like, oh, I want to take dermatology, or I want to take radiology because of the work-life balance or the salary.
So yeah, I have to admit that even in internship, we had radiology postings. I had opted for, like, we have elective radiology postings. You're not forced or obliged to do that, but you may do it if you're interested. And I had opted for it definitely, but then I did not end up going. I was busy with other things. But I always had radiology in the back of my mind when studying, because I had heard that radio and dermat are one of the top fields which require top ranks. So I was keeping radiology as a benchmark, that I want to get to this level. I want my rank to be good enough to take radiology, and then I will decide what I want to take. And I have always been interested in the diagnostic part of medicine more than the treatment part, or just figuring out what is the issue with the patient, then figuring out how your treatment will affect it, just like the theoretical part of it. So after thinking about it a lot, I was confused between medicine and radiology. So then I thought that removing the treatment part from the medicine, the field of medicine, and just focusing on diagnostics, that is what I wanted. But it's not possible to do that when you are in patient management, like you're involved in patient care. So radiology gives me a good balance of exactly what I want. Work-life balance is definitely a priority, like you said. And apart from that, it's focusing on the diagnostic aspect of medicine, and I'm genuinely enjoying that. Like last 15 months of my residency, I've genuinely enjoyed that a lot. So I think it was a right fit for me.
Super. One thing I noticed, right, is I think you vlog a lot during your day, right? And I think I'm sure a lot of medical professionals benefit from it a great deal, right? Watching a resident doing the job before they have to do it, right?
Yeah.
Share a little bit about the process. Why do you do it? What are the motivations?
Yeah.
How do you manage such a busy day while also taking a recording of it?
So my main thing was that as an intern or as a UG student, I had not seen what a radiology resident's life looks like. So going into it, we were just like all of us, almost all of my batchmates, we were little uncertain, like what will radiology residency be like. We'll just go there and figure it out. So I thought that people who want to take radiology, like maybe they have a certain picture in mind that this branch looks like this, the work-life balance is going to be so great, for residency will not be hectic, or just they'll have some idea or some notion in their mind about residency which might not be true, like for the better or for the worse. They might come to residency and find out that, oh, this is not what I imagined. So I thought vlogging my life as a radio resident, it might help people to just have an idea, like before you opt for the branch, what does the branch look like, and what does the branch look like in residency, because residency and private practice or working after your residency as a postgraduate are very different things. So I wanted them to know what residency looks like, so they can take a informed decision, like whether this is something I want to really do, and this is something that I think I can do. I'm hoping that I've only put out 2 vlogs of my residency so far, because I simply do not get time to film and edit all of it. But I'm hoping that whatever I have uploaded so far has helped people to some extent at least. If it has helped even like 5 people, then it will have been worth it for me.
Assuming today there will be many aspiring radiologists, right? People who've given the NEET PG examination are probably getting placed as we speak. What are the pros and cons of taking radiology or radiology as a profession?
Really, I feel like every branch has a lot of pros and cons. It's just that you as a person, what your priorities are and what you think you can manage, that is what makes every branch slightly different for every other person. So like what is right for me, the pros which are pros for me might not be pros for somebody else. But speaking from my point of view, like I was somebody who knew that I cannot work excessively for like 48 hours and run on no sleep, no good food, and just like keep working the way clinical branch residents do. I had seen that during my internship. I had seen that when my brother was doing his residency, and I was simply freaked out. So radiology residency definitely has pros that I get rest. I like even on call days I can at least rest for 2-3 hours. Then I can eat food whenever I'm hungry. So like even if it's delayed, our seniors and like there's a culture in radiology that you don't make your juniors go hungry and work. Like there's always that thing that you first go, you eat, then you work. you're supposed to work, no wonder, but you're supposed to be rested and you are supposed to be well fed when you're working. So I like that work culture. Like there is no unnecessary toxicity of just like don't eat, don't sleep, just keep working. So that I have not encountered in residency, and nobody that I know who is doing radiology, like they have also not encountered this. So I think that is great. Plus, like the fact that radiology connects the entire hospital together. Like I did not realize this before joining residency, because I had only seen people working in private practice. Like I was shadowing radiologists, but they were working on their own. They were getting references from other places, but it was not an institution. When you work in an institution, you find out that radiology ties everything together. Like all the branches, every single field, like all the other departments will require some scans to be done. You are the one doing those scans. People are coming to you to discuss the diagnosis.
Diversity of the experience.
Yeah, you get to see so many things. Like if you are a nerd, which I am, like you like radiology because there's really so much to know. You have to study a lot. You have to know a lot of things from different branches. I need to know about pediatric disorders just as much I need to know about gynecological disorders. So I need to know everything, and I need to help the clinician tie the ends together and come up with a diagnosis or a management plan which will be better depending on the scan. And obviously I'm a very junior person in the department and I'm saying this, but there are people out there in radiology who are doing wonders when it comes to all these different fields, like all the subspecialties. So yeah, just the possibility of doing multiple things makes me really interested in radiology.
So you mentioned subspecialties, right? I think radiology has many subspecialties.
Yeah.
Could you share some? And do you have interest in some? Or if you do not, why don't you?
When everybody joins radiology, first thing which they think about is that interventional radio, like that it's the new...
Interventional or diagnostic,
Yeah,
right?
yeah. So like everyone's drawn towards interventional because like people say it is a very lucrative branch. It's something that not everybody can do. You have to be very skilled at the job, and it pays well, then it's respected well. It's like doing radiology and still getting the treatment aspect of medicine. Like you can still treat patients.
Yeah.
So everyone's really inclined towards it, but it's really hectic. Like I tried it, I loved it, but I don't know whether I'll be pursuing it in the future. There's neuroradiology, like people who only focus on brain, the neurological imaging and neurological disorders.
You know, radiologists, I think, have multiple options post they kind of, complete their education, right? Either they can start their own clinic, they can join a private hospital, they can join a government setup, maybe some research, maybe some teaching as well. Have you thought about it? Any kind of pros and cons? How should younger students think about this as well?
It will, like there is a lot of factors which will affect this, I think, because staying in a government setup, there's difference between the government setup, the difference between being in a government setup and being in private practice is that the kind of cases you get to see. So in a government setup, you'll be seeing cases which you have only read about in your books. Like you won't be seeing this variety out in private practice. But at the same time, there's a lot of, I think there's a lot of administrative work that comes up when you become a senior in a government setup. So if you are somebody who really enjoys teaching students, like we are taught by our faculty, like faculties hold academic sessions for us, they teach us, and their joy is teaching students. So they don't mind the administrative work and all that. They are happy teaching and they're happy seeing rare cases and good cases. So if you as a radiology resident, that is something you want to forever keep seeing good new cases. You want to write about these cases and present them in conference, like because whatever you see, the entire world out there is not seeing. Especially in India, you get such a variety and so many cases. Whatever you are seeing is a rarity out there, especially out of India. So whatever you have to share, it's going to be really valuable. So as long as you are in a government setup, you get access to all this. You get access to faculties, the HODs, the professors. They teach you a lot because they have a lot of experience. As opposed to that, I think in private practice, it's more about what is more common. Like the most common things which happen to people, they present to a private place with that first. Later on, they get referred to government if it's a rare thing. But so in a private practice, I think you will end up seeing more cases which are common or like day to day. So it's a really wide spectrum of things. So depending on what you enjoy, what you like, what you don't like, if you like good work-life balance, if you want to stay away from like administrative work, just work and then leave and get home. So I think private practice is good for that. I am yet to make a decision about this because I am only a junior. There's so much stuff for me to see yet and to learn yet. So I don't think I am ready to make a decision about that yet. But yeah, you should finish your residency and see what you enjoy and then make a decision about that.
One thing, I came up in one of my conversations with a senior radiologist was that one of the joys of being a radiologist is that in some sense you're a doctor's doctor.
Yeah.
Right? Could you speak a little bit about that? What does that mean?
Yeah.
And do you like that? Do you not like that?
I've heard this before. Like there was a senior radiologist that I was speaking to, and he told me that when you are in other branches, you are a doctor to the patients. In radiology, you are a doctor to the doctors. What that means is that you will not be approached by patients per se, clinicians will be approaching you. And there is, each radiologist has a different way of reporting. Like even with my seniors, I have seen that everyone sees things differently. Like the wording of report will change slightly. Somebody has a better understanding of the disease itself, about the management, how your reporting affects the management. So with that experience, people report differently. So some clinicians might refer all the patients to you because they like how you think, how you report. So you have to be appealing to the clinicians and whether your reports are appealing to the clinicians. So you are like a doctor's doctor. So you are actually being you're actually consulting these other doctors rather than patients. So you have to be appealing to them. I think that's why they say that you are a doctor's doctor. It's quite nice, but like you are, it's like having academic discussions with other clinicians. Like it's a mutual exchange. They find out something from us, and we find out something from them. Yeah, it's like a mutually beneficial thing. And if the clinician likes you, then he is going to stick to you for all his future reports and all his imaging requirements. Yeah.
I know you're early in your career, right? But one of my conversations with the senior doctor was that often doctors need to market themselves, right? Mm-hmm. Build their practice, build relationships with potential patients, maybe with hospitals. But they say it depends on kind of practice to practice, right? It depends on kind of specialty to specialty. Radiology, do you think, does it demand a lot of marketing? They say anesthesiology doesn't, right? But maybe other internal medicines, more OPD focused practices require that. What are your thoughts on radiology?
Yeah, so far I have not heard a lot of people talking about marketing or about building your brand when it comes to radiology, because like I said, it's less to do with patients, because patients are not going to come up to your door and be like, I have abdominal pain, please do USG. Yeah. That's not going to happen. It's going to be the clinician. It's going to be more about networking, really. More than marketing, I think radiology is going to be about networking, about coming in contact with other doctors and them seeing your work and then them referring patients to you. So it's going to be less about marketing, more about like reporting so well wherever you are, even in like a teaching institution or whenever you're doing your bond. Like every report that you make, when reports come to us, we also check like outside reports. We check who has done it. Like we check the name. There are some names which are actually like very famous. Like our seniors also keep saying, "Acha, this scan was done by this person. He's very famous. It must be accurate." So that is the kind of brand building you have to do. Not with patients or with the general public. More with like the doctor community. You have to build reliability and like accuracy. Like they need to know that if you have done the reporting, she has done it, it must be right. It's what I'm going to see when I open the patient and when I take her up for surgery, because this doctor has reported like this. Like that is the kind of reputation that radiologists have to build. I have heard my co-workers and all talk about this, like my co-residents, they're like, "Acha, you have done this report, it must be right." So that is the kind of satisfaction that you get in radiology. So it's going to be less about marketing, more about building your own name in the community itself.
So it's 6:30 p.m., doctor, and you've just told me that you'll be going back to work after this. You'll be going back to KEM. Tell us how residency has been. Clearly, it's a busy time in a medical professional's life. How's it been for you?
like in radiology, when you join, you are just somebody who knows nothing, because we don't know even how to hold the USG machine's probe. We don't know how to do the scans in CT. We don't know anything. So you are learning from scratch. So the first 3 months is just seniors holding your hand and teaching you, like, yeah, aise karna, yeah, aise karna. So the first 3 months, you're just getting used to all this. You're doing patient management, basically things which your seniors are not doing. You are doing that as a first year. And now I'm in my 15th month of first year. Like, thanks to juniors coming late, I'm doing extended first year. But yeah, first year is the most hectic. Like, for on-call days, you get like maybe two hours of sleep, or you are working like round the clock. You are working your routine hours, then you're going for your on-call duty, then you're again coming back for routine hours in the morning. So it's not as chill as I had imagined. Like, I had thought that radiology and dermat are going to be extremely chill, but I was told by some seniors that I contacted in radiology that if you're taking radiology because it is a chill branch, then you are mistaken. It's not chill. So you think about it again. Think about the other reasons you want to go for this this branch. So yeah, residency so far has been rewarding. It has been taxing, but it has also been rewarding. Like, as a first year, all the work which I have done so far, I know that at the end of first year, now I know for sure that there is something that I know, like I have a solid foundation and I can pass it on to my juniors. So yeah, it has been pretty good compared to the other department residencies which I see. I think ours has been definitely much better. So it has been rewarding. Yeah, it has been enjoyable so far.
Super. They say the first day of residency is very, very special. Describe your first day.
So on our first day, like a big group of us joined. We gave our joining letters to the HOD, and we were just being allotted to different places. And we were just being taken under the wing by our seniors. Like, our seniors like, हाँ बैठ इधर, मैं दिखाता हूँ, तू ये लिख वो लिख. So I was in ultrasound the very first day. I think maybe that's why I like ultrasound so much. I got to learn a lot from my senior. And I was writing, like initially you're writing reports and you're looking at the findings which your senior is showing you. So that is the basic work you're doing. So that is what I did the entire day. We saw a lot of obstetric scans as well. Like, I was posted with my senior who was doing obstetric scans. And like, it's always fun to interact with all the pregnant ladies who come, because they come with dabbas, they will come they will sit all together like a small community, and then we will do scans, they'll chat with us. So yeah, it was a special day. I think I like ultrasound so much because I joined and the first thing which I did was ultrasound. So it has impacted my experience of residency so far in that way, that I like ultrasound maybe more than other imaging modalities.
You mentioned senior, right? How were your relationship with your seniors, and anything you'd like to share on kind of the coming juniors, or how their relationship should be with you?
Yeah. So I'm blessed to have a lot of like amazing seniors. Obviously, there is a level of there's a small barrier which you have to maintain between seniors and juniors, because you can't be completely candid with them, because you have to respect them, and to a certain level they have to be like, they have the authority, or they are supposed to teach you and kind of punish you when things go wrong, like yell at you, scold you when you are messing up, and you are like in this field, when you're messing up, it's a medical legal thing. It is a thing, like it is something that's going to affect the patient's management and life. So you are supposed to be very accurate, but obviously you're going to make mistakes. So the seniors are there to reprimand you, like they are going to teach you what is right, what is wrong.
Yeah.
So for them to be taken seriously by us, there is a certain barrier which is there, that you can't be completely candid with them. But I have many good friends in radiology. Most of them are actually my seniors from UG itself. Like a lot of UG KM people who are there in my senior batch. So they are absolutely wonderful. Like they teach us a lot, and I genuinely feel like there's just 1 year of difference between us, but the experience which they have and the amount of studying and efforts which they've taken is great. So the senior-junior relationship which we have is quite nice. Like other departments, obviously their work is more demanding, more challenging. Their working hours are worse. So I think they have a slightly tense relationship when it comes to seniors and juniors. But we have a very a nice friendly atmosphere in our department. There is a trend in medicine that each coming batch, the toxicity goes on reducing. This is true for all departments. So I'm just hoping that the juniors which we get, they'll be good with us, we'll be friendly, and we'll teach them all that we can teach, and also be a little stern. So yeah, that's what I'm expecting from the coming juniors.
So that's very, very refreshing to hear, right? Because I think sometimes you see on medical social media, right, med Twitter, where all the time there's about the seniors are toxic, that there are toxic relationships, they treat us poorly. So it's very refreshing to hear you say that things are getting better and you have a wonderful relationship and you attribute a lot of kind of, your settling down into residency to your seniors. I'd actually like to talk to you about a very unfortunate incident, right? All India Rank 1, NEET UG 2017, radiology resident from AIIMS committed suicide. Very, very sad, right? What are your thoughts on kind of mental health for medical professionals?
It's very difficult to ever be able to tell what somebody is going through. Like, I have actually, like, that was my senior from UG also. So the thing is that you can never tell what somebody is going through, what battle someone is going through. Like, before being rude or before being bad to somebody, even as a senior, when you're yelling at your juniors or you're telling them to get things done right, like, you never know the kind of mindset they are in. So it's always, you're supposed to be kind to them. And also, as a resident, there may be other things going on in your life which are affecting you mentally. So sometimes that stress of residency added to stress of other things in life, or maybe just even if there's no stress, like, you in depression, there's this thing called primary depression, secondary depression. Sometimes the depression is secondary to nothing. Sometimes it's a primary health condition, like it's a disorder. And like, you can never look at a person and be like, this person is doing completely fine, this person is not doing fine. So yeah, like, I don't have very insightful things to say about this, because I am a very junior person and I have not experienced bad enough things to be like, residency is chill, don't just take it too seriously, just get over it, it's just 3 years. I can't say all this because somebody somewhere is going through a different mental battle. I know that many people that I personally know in my college as well have had one rock bottom point at which they've been like, I want to run away. There are people who have actually like got run away for like few days and then they've come back, because it gets too much. It gets very overwhelming after one point, and I'm not sure that everybody has the same reasons for going through tough things, but you can't go up to somebody and be like, teri residency kitni chill hai, you just get over it. So everyone's fighting different battles, and it is difficult to pinpoint any one thing about it. Like, I know this answer was a little scattered, but it just makes me really upset. Like, I wish I had better things to say about this. I had a better solution to give, like, this is the reason for this, or this is what is causing this. But the truth is that there is no real reason for this. Just one solution is that all of us, including seniors, juniors, everybody has to be a little kinder to everybody around us. That is the only thing which is possible for us to do. And as a senior, I hope to become somebody who is a person that my junior can come to and tell me about any issues they're going with. Obviously, you have to be a little mentally tough when it comes to the extreme work hours, and you have to be little prepared mentally, but not at the cost of your health, your life. If it's something that's affecting you physically or mentally, then you should take a stand for yourself. And I am like really regretful that if anybody out there has ever felt that their residency is what is causing them the most harm, like, I really wish that nobody else goes through the same feelings, or nobody else has to be like they're helpless, completely helpless, like residency, they're just trapped here and they can't get out of it. That is how usually the thing becomes. You get a very closed outlook on everything. You forget that residency is short-lived. You forget that after 3 years of this, you are not going to be forced to do all this extreme exhaustive work. Everybody forgets that, and you just focus on something right in front of you. You forget to see 3 years later what's going to happen, and it's natural because you are in a closed space. You don't get to go home for many days. You don't get to talk to people. You're just there with your work, with your patients. So in first year, it's very likely to go through all this and just want to give up. But we have to remember, we have to force ourselves to remember that residency is just 3 years. First year is just 1 year. Things will eventually get better. everyone should have one person to remind them that things will get better.
Yeah.
That's all.
Thank you for sharing that. I think that was straight from the heart. So in most professions, if you're not liking the particular job, you can move on. So if you're in banking and you don't like banking, you can move on. If you're in acting, you don't like acting, you can move on. But in medicine, it's not the same, right? If you're a resident, you have a bond. Do you think this is one of the reasons where sometimes medical professionals feel trapped up mentally? What are your thoughts on that?
I've always looked at bond as one added year of experience. So thankfully in Maharashtra, we have only 1 year of bond for UG and PG. And PG bond, most of the time, like whenever you're doing SRship, that is senior residency in your department itself, it counts as bond. So I looked at, like, most people go to Delhi and go to other states because they're trying to escape the bond. But you definitely need to do at least 1 year of senior residency or SRship, as we call it, to get further experience. Because till 3 years of residency, you're just you're learning your things, you're learning new things, and you are building foundation. Once you're an SR, you are helping your juniors, you're refining your skills. So I have always looked at a bond as something that is just adding to my experience, and which anyways people, when you go out into private practice or you go out into the world outside of government, they want you to have more work experience, they want you to have more teaching experience. So I always thought that bond just serves like one of the things which you just have to do along with residency. But of course that is not true for people who are in other states. Like some states have like 3 years of residency, 3 years of bond beyond residency.
Yeah.
So then that becomes a little taxing, and especially if you're going out of your state into another one, so you have to stay there extra for those 3 years. You don't get to come home so soon. So yeah, this is one of the reasons, like some people might feel like they're getting trapped and they are getting trapped doing residency, like just to get the branch which they like and the college, a decent college, they'll move to another state, but because of the bond they'll be stuck there, they won't get to come home that often. So that is an issue. But yeah, like once you are in it, you are in it. Leaving it becomes like a big taboo also. Like if you find out that this person left their residency, this person left, so that becomes like, Arey bapre, like they sacrifice this huge thing, like, and you get like penalty also. Like once you leave, then again you have to wait for 2 years to give NEET and then again get a good seat, like to be able to apply for counseling. So yeah, like once you are in it, you are in it. So when you're making the decision, then only you have to be completely sure. But most of the times it happens that people are not happy with their decision, but they can't leave because of the fine to pay or because of the loss which they'll have. Yeah. So once you're in it, you're kind of stuck. So you have to make a wise decision. So you're stuck with whatever branch you've taken, that is of your choice.
So you had an All India rank of 7. The traditional path would have been to probably take MAMC, right? Yeah. But I think you ended up taking KEM. Yeah. Any reason behind that?
So big reason was for me to stay close to home. Of course. Like I have been staying away from my family since I was in 11th standard because I wanted to study for NEET UG, and there are no good classes or coaching available in the town where I live. It's a small town in South Maharashtra, so there were no coaching classes. Now they are there, like obviously 8 years later they have coaching classes, but back then there was nothing. So after finishing my 10th board exams, I immediately came to Mumbai for my further education. And I have been living here ever since then, only visiting home in like Diwali or Ganpati or blah, blah, blah. So even if the physical distance between Delhi and my hometown, even if you can cross it with a plane in like just 2 hours or 2.5 hours, it's still a place where I don't know anybody and I don't have any relatives there, and it's just another state altogether. And I spoke to I have some seniors who are also top rankers from like their NEET PG years, like AIR, All India rank 8, All India rank 50, like these people are also taking KEM. So I spoke to them, I sought out their advice, like why KEM and why not Delhi colleges. And the answers which I had is you get pretty good exposure as right from your first year of residency here, like you get hands-on. I think there is a trend, I've heard that there's a trend in Delhi that the seniors have to oversee a lot of things. Like as a junior, you don't have the independence to dispatch things on your own. Here we are doing that. We are making mistakes and learning from them. So I think because of more hands-on exposure which we are getting when it comes to reporting or when it comes to doing ultrasound, so that is allowing us to make more mistakes and make more change those things and correct our mistakes and learn more. So I had heard this, and obviously this is my home ground, it's my UG college. I know how things work here. So I think all in all it was a decision that has helped me get through first year mentally sound. I think if I was in another state or if in another city away from my family and away from everybody that I know, it would have taken more mental work to get used to things and to try and deal with everything alone. Now I have support, I have friends, I have family. So I think getting through residency is going to be easier. So like in the end, in the future when I am a radiologist, like most of the times we talk to people now, like we talk to a consultant, we hardly ask them like where have you done your PG from? Like eventually what matters is what kind of experience you have built and what kind of work you are doing. So I am sure that even after not going to Delhi, I'll be able to do the same kind of work and at the same level of expertise which they are doing. So it's just a little helpful to me, like mentally, thoda kam taxing hai. So I'm happy with my decision.
Sounds like the perfect decision.
Yeah.
Would love to, hear from you a little bit about your strategy of cracking the exam, right? NEET PG, right? Any particular techniques, any particular routines, any discipline that you kind of put in. I'm sure there are a lot of aspirants hearing this, right? NEET PG 2025 is not very far away, right? So they would love to hear from you.
Yeah. I guess there are like the newer toppers might be more relevant to the people now.
I think you're very humble. I'm sure you can add a lot.
Yeah. My main thing was solving a lot of grand tests. Like I have said this like many times before. My main strategy that helped me turn things around. Like our exam was in March. By December, I was still scoring like just decent, not amazing. My rank used to be around like 4,000, 5,000, and I was just struggling to get in the 3-digit rank zone. And since January and in Jan and Feb, I really focused on giving a lot of tests. And like people often forget that it's not just studying; it's the art of giving an exam. Like it is completely possible for somebody who doesn't know a certain topic to answer that MCQ just because he has figured out the language of an MCQ or the language of the question, how to look at the options and eliminate the options. Like it's a different skill. You just don't have to study blindly and apply that knowledge. You also have to figure out the tips and tricks to how to solve a test. Like we have negative marking, we can leave a question entirely unattempted, but then you have to weigh the pros and cons of leaving that question and losing out 4 marks, or maybe getting that question right, gaining 4 marks, and or the risk of getting it wrong and losing 5 marks. Like this is all the mental calculation that goes on in your mind when you're giving a test, and often we forget that you're supposed to calculate. Like me and my friend, like my study partner, we used to sit and decide I'm going to attempt these many questions. Let's assume that these many will be wrong. Then I will lose these many marks. I can still get this amount of, like I can get these many marks. So then my rank will be this. It's not just studying and then giving a test. It's about how to give a test. Understanding what the examiner is asking you, how the MCQ is worded. Sometimes there's a MCQ which answers the question to a previous MCQ. Like just the how to give a test, that was something that I focused on in Jan and Feb. And then I noticed that even though my reading was the same, my revision, like my source of material was the same. I was sticking to the same source. Still, because of so many tests which I gave, it refined my skill of giving the test. So I was able to make lesser mistakes, do better time management, and just overall I was letting myself apply my knowledge in a better manner without getting very frantic about it or without panicking, just giving a test in a calm manner. So that is what helped me. And everything else, I am sure that people already know you're supposed to stick to only one source. Like you take a source for a certain subject. For example, if I'm reading this particular book or these set of notes of mine for medicine, I'm not going to change it just because somebody recommended to me that, oh, this is better for medicine, or this is more concise, you should try this out. No, like if I've used one source, I will stick to it. So consistency is key and repeated revisions is key. So you read you read the notes for one thing, you stick to it for revision, you do 2 revisions, and then you practice giving tests. This is how I tried to go about it. And I was in my internship year, so I was also doing internship at the time. Granted, our internship is not as hectic as some other colleges have. Like some colleges in periphery and colleges in south have very hectic internship duties. Mine were not that hectic, so it allowed me to study, definitely. But this is the strategy which I think anybody, like even somebody who is taking a gap year to study for NEET, this is how it should be. Like you stick to one source, you do multiple revisions, you figure out how to give tests well, and you give multiple tests as you get closer to the exam. That is the strategy to follow. Yeah.
You spoke about how you balance internship and NEET PG, but I saw in one of your vlogs that you had a rural posting as well.
Yeah.
How did you manage studying for NEET PG while doing the rural posting as well?
Yeah, so rural posting, the thing was that you attend your OPD duty hours like till
Where were
3,
you
4
posted?
I was posted in different places actually. One of them was Kasara, like Kasara PHC. We were posted at primary health centers. So we would be with our, like few of our batchmates in one PHC. So you will be staying in the PHC ka side room for the doctors, or they'll have a quarter, like they'll have quarters for the working doctors there. So we would stay there, and then after you're done with your routine hours, like you will tell the nurse or the compounder, like the whoever is working there, ki, call me if there's an emergency. And then you go to your room and you study. And then whenever there's an emergency, you go and attend to that. So I, like, the main thing was you have, when you're studying an internship year, you have to get over the obsession that I want to sit at one place, I want to sit at my study desk and I want to study. You have to study wherever possible, make most of wherever you are. So we were in rural posting, there was free time, so you have to sit on a mat or you sit on a bed and you study there. So you make most of what you have.
Super.
Yeah.
I saw that you spend a lot of time journaling, right? You maintain a diary. Tell us a little bit about that.
So I have been, like, this habit I've had since 11th standard, actually since 10th standard. Like to study, I feel like I need to write things down. It's always better to plan things out in advance and then write them down on a piece of paper and then follow it. Like you save yourself from constantly making the decisions, like the mental work of constantly having to make a decision of what to study next. I like to plan it out, and also I find it slightly therapeutic to write down my thoughts, whether negative or positive. Mostly I try to keep it positive, but sometimes when you have to recollect yourself or you have to just reorient yourself, I think it really helps writing in a diary, and it helps in building routines. Like I'm a big believer that you need to have a good routine to increase your productivity and to be disciplined. So I, like, even before NEET PG, I used to have a certain morning routine and I would write it down the night before. So it would help me to follow it the day after. So it's just a habit building kind of a thing. If you are somebody who feels like you lack structure and you lack the ability to make a decision in the moment of what you want to study, like your planning thing needs more work, then writing a diary is a good habit to maintain for that.
How did you feel during the NBEMS award ceremony?
Yeah, that was amazing. Like we got an email from the Ministry of Health and Family Welfare. So we got an email from them saying that you are invited for this event. And I knew about this because I had heard about my seniors going for this award ceremony 1 year ago. So when my rank came out and I was thinking about it, like I'm going to get invited for this mostly. Then we got the email and then I told my parents. My parents were over the moon. Like they were extremely happy. So yeah, we all just made a small trip out of it. We went there. We went to the NBEMS head office, and we had a 2-3 hour long celebration is that placed, and they had a lot of toppers there, not just from NEET PG, like not just from MBBS and MD side. There were also people who were BDS, like dentistry. So their top rankers were also invited. Their family was invited, and they were going around asking the parents, like, how do you feel about your child achieving this? And everybody there was just so proud of their children, and everyone was really happy. Like it was a good atmosphere, and I think my parents definitely loved it a lot. Like my dad still he's just like that was a really nice day. So I think we have something we'll just remember for the rest of our lives.
No, I can't even imagine. It must be so special for the family and you. So we know MBBS school is not just, medical school is not just about academics, right? There's also happens a lot more. There's also quizzes, there's elocution, there's maybe sports. Did you do any of it?
I was only in dance. Actually, I really liked dance. And when you join first year of MBBS, the only thing you have in your mind is fest, college fest. Like, what all events do you have?
Yeah.
Like, seniors put up this one program for us in our first year where they introduce us to the different functions which we have in the college fest. Like, we
Yeah.
have an acting team, we have a dance team, we have this, we have that. So you audition for different things, you get
Yeah.
selected. And I had auditioned for the dance team.
Yeah.
I had gotten selected. Like, for the first 2 years of MBBS, before studies got really hectic, I was in dance.
Yeah.
Really enjoyed that. And we used to play sports as well. It's just like, there are some people who take a lot of stress when it comes to studying for MBBS. Some people take stress right from the first year. But opting for these extracurriculars and all made me realize that these 5 years are not just for studying. Like, you need to build a community, you need to make friends, you need to go out there. Most of like medical students find it, like, most of them are introverts, or I was an introvert myself in first year as well. Then when I joined the dance team, I got to know more people, I got to talk to them more. So it really helped build my personality to what I am today. So yeah, extracurriculars in UG you have to. Otherwise, you're gonna regret it once UG is over, and it gets over like this in 5 years. 5 years get over so quickly. So better to have no regrets and try out everything there is to try in MBBS.
So wrapping up, I read that you're into a cappella, right? Would you feel comfortable probably dedicating a particular song, or maybe doing a quick recital?
Okay, I'll just sing something. Is
Please,
that
would
fine?
love it. I'm sure the audience would love it.
Okay. कागज के दो पंख लेके उड़ा चला जाए रे, जहाँ नहीं जाना था ये वही चला है रे, उम्र का ये ताना बाना समझ ना पाए रे, जुबां पे जो मोह माया नमक लगाए रे, कि देखे ना भाले ना जाने ना दाए रे, दिशाहारा क्या मुंबुका untare.
Wow, super.
Thank you.
Phenomenal. I think so much talent right there, right?
Thank you.
But Dr. Jui, it's been an absolute pleasure to host you on Behind the Scrubs with Knya. I've actually learned a lot from this conversation, right? I think a couple of things that I felt were, phenomenal. Is that I feel you're a very, very humble person with so much of success. I think the humility that I think clearly it's the environment, right? I think your family, your brother, maybe the right friend group that has probably instilled that in you, right? I think second thing I learned a lot is consistency, right? I think you cannot become a good singer without consistently practicing. But besides that, jokes apart, I think medicine, about cracking the examinations, about consistency and just every day showing up, right? And I particularly enjoyed the fact where you shared very positively about the culture that you have in the radiology department at KEM, that you really appreciate your seniors. Almost every medical professional I speak to kind of has been a little bit disappointed about the relationship with seniors, the toxicity that goes in medical college. But I like the fact that you said that it's getting better every year, right? And I think it's the lens at which you look at life that sometimes is what life gets delivered to you, right? So I learned a lot in this conversation, and I'm sure your audience and our audience at Knya would learn a lot as well. I'm sure a lot of people will reach out to you as well and be inspired,
Thank you for
with
having
your
me.
journey, right?
Thank
So
you.
thank
It's
you
been
so
a
much
pleasure.
for coming along, and I feel bad that you're going to be going back to the hospital on a Friday night, but I guess the service that you are providing to the community is phenomenal. So thank you so much.
Thank you so much for having me. I had a pleasure talking to you.
Thank you so much.